Good day to you, and thank you for tuning again into our podcast, Power Up Nursing. We are growing our listenership and viewership so much more quickly than I ever imagined, and I appreciate you for that. We did a few weeks ago an awesome podcast with a company that has a device that immediately mitigates stress and anxiety from our lives. And as you know, we are a nurse driven, mission based company that advances the science and spirit of nursing. And one of our major objectives is to help healthcare professionals reduce burnout, kind of ameliorate the stress and negative anxiety that plagues the daily work environment. This device, as many of you got the introduction to, does exactly that. And we had such positive comments and such good downloads of it that I decided that it's time to learn a little bit more about the science of anxiety and vagus nerve stimulation. So today, I have invited the co-founder of Pulsetto. I'm going to really butcher his name, but I want to respect the fact that he is from a beautiful place called Lithuania. And his name is Vitalijus Majorovas. And welcome. And you're going to give us a little bit of background. I'm going to call you Vita because it's all Latin
Yeah,
from
yeah,
vitality
cool.
and life. Give us a little background of who you are and how this device came about. And then we're going to start talking about how it works.
Yeah,
Welcome.
thanks. Yeah, thanks for the intro. Really nice intro. Thank you very much. Yeah. I am from Lithuania. It's a country in Europe, Central Eastern Europe. So I'm originally from Lithuania, and basically Pulsetto, our company, is headquarters are in Lithuania. So I spent in my past I spent more than 15 years in corporative life. I was working in different companies, but mainly all of them was related with sleep products. I was working in Turkey, in Hungary, in Lithuania, in different companies, sleep related. So at one point, I decided to go deeper in this topic, and I became a certified sleep and recovery coach, and one of the best, let's say, in Lithuania at this moment. I'm still speaking a lot and educating a lot about sleep. So I have this theoretical background, but at the same time, I'm doing a lot of biohacking things on sleep. And I did 200 night experiments with sleep. So I tested 70 different factors, from eating kiwi before sleep to infrared lights, and other stuff. So the sleep is my passion, big topic. At the same time, I have a wife, and she has cluster head pains. It's like 10x migraine, something like that. It's 10 times stronger than migraine, and it's appearing quite rare, but it's appearing. It's usually appearing in the middle of the night. Let's say once per year. It can be once per 2 years, and etc. The other name of this pain is suicidal pain. It's such a strong pain that somebody is like cutting your head with knife or something like that. So, and in our past, we try a lot of things because there are no treatment basically, but there are some prevention things, which can a little bit decrease the amount of pain. So for example, oxygen therapy, even there are some studies about LSD microdosing and etc. So we tried a lot of things, and then 5 years ago I read a few articles about vagus nerve stimulation and possible treatment of the way of or decreasement, let's say, of the cluster head pains. And this is how I dig deeper in this topic. I spent a lot of time, and then my question was, who is the best expert in vagus nerve stimulation in Baltic countries? And this is how I met Povilas, my other co-founder, which you had interview last time, because at that moment he worked with the invasive vagus nerve stimulators. There are a lot of invasive vagus nerve stimulators, and this is how 3.5 years ago, we created Pulsetto. And in 9 months we basically built the product from scratch.
Birth
So
the baby in 9 months.
yeah, basically it's like the same. Yeah,
Mhm.
but still we cannot claim that we can treat cluster head pains and
Mhm.
migraine. But this is our goal because there are a lot of studies about vagus nerve stimulation and cluster head pain. So at least I know that I have Pulsetto as a weapon, for my wife. Even
And
if
I
it
keep
still,
mine close too.
yeah, still, even if we cannot claim this, but we have a lot of customers, by the way, who are using Pulsetto not only because of stress reduction or sleep, but also for the head pain. And we have even dedicated program, pain management program, and we have one trial with the Bechterew disease patients, and I mean, pain management is a big topic about the vagus nerve, and this is one of our goals in the future to go to the migraine field also, because
That's
this is
exciting.
the big, yeah, yeah.
Vita, for Power Up Nursing, our chief science officer is a neuroscientist, a PhD researcher, and her field of inquiry and her methodology is around pain. So I would very much like to connect you both as well. But I want to stop for a moment. And, I have kind of pinned this for a presentation I'm doing this week. And I always say that like food is the best medicine, right? Exercise is the best drug, but sleep is the ultimate healer. Sleep. And so to hear you say that this was born of sleep, I'd like to start there. How does, and I will also say this as a personal testimony, everyone that's listening knows that we are huge partners of Ultra Human and the Ultra Nurse Project to reduce stress, anxiety in nurses and to prevent burnout. So we wear these rings and we're working with hospitals across the United States. But when I got something like this, I said, oh my goodness, I actually have an app that tracks my stress, tracks my sleep. So why not use this as an intervention device? And so I do around sleep because what I've discovered is that if I use this, and it's quite a simple modality, I'm doing it wrong, sorry. Quite a
Yeah,
simple modality to place on your neck with a little bit of, a little
sure.
bit of gel so that
Yeah,
it's a conducer, right? I set it to the sleep mode because
yeah,
I don't have to stay awake. Sometimes, I like the music, I like the meditations, but I don't want to feel forced to do anything. This is something that does it for me. So I'm a little lazy at night.
yeah,
And what I've discovered, and I'll say this, what I've discovered is that, one of the beautiful things about Ultrahuman is it really tracks more than any other device that I've used different levels of sleep. And we know that those different levels do different things. And we know that REM sleep, as you know, and you can talk about, helps us emotionally. It's restorative sleep. But nothing is as physically restorative as this kind of thing that's really hard to get, which is called deep sleep,
yeah.
the deepest sleep. And this has increased mine on my Ultra Human Ring by 50%. If I don't use this, I get 45 minutes of deep sleep out of 6. If I use this, it'll creep up towards 2 hours. How does that work? Talk to us, please, Vita.
So I mean, yeah, it's a very good point, but there are several pathways how vagus nerve stimulation improves sleep. So the first, let's say, like a basic pathway, because the vagus nerve stimulation activates the parasympathetic nervous system, which is responsible for relax and digest, for rest and digest, basically. Yeah, and one of the most common things why people cannot go to sleep, or when they are waking up they cannot go to sleep anymore in the middle of the night, it's stress. It's like a top reason why people has some issues with sleep, and etc. So what we see from our data that we can affect the sleep latency, so how fast you are going to sleep and etc. So this is the one pathway, it's just reducing the stress, activating the parasympathetic nervous system, and that's it. And many of our users are using Pulsetto as their wind down routine, element. Somebody is
And
using
it's
it.
so easy.
Yeah,
It's so
somebody is using.
easy.
Yeah, because you can multitask. I mean, at the same time, while doing the stimulation, you can do, other
Mhm.
stuff. You can watch TV or you can do cooking or whatever. It's not restricting your movements and etc. So a lot of people, a lot of our customers are using Pulsetto as a part of their, let's say, bedtime routine. Some of
Mhm.
them are using other things together with Pulsetto. Some of them are using only Pulsetto. You don't need to wear this device for hours. It's
Mhm.
like a five,
Mhm.
7, 10 minutes stimulation.
That's
That's
the
it.
beauty too. It's not
Yeah,
hours.
Yeah, exactly. So this is the one pathway. The other pathway where we see that we are affecting, let's say, that we are affecting the deep sleep is that basically vagus nerve stimulation can really positively affect mitochondria, which, by the way, is producing melatonin. And this is a very important part, that melatonin is not only produced in the pineal gland but also in the mitochondria. And mitochondrial, let's say, activity and the efficiency of mitochondria is very much dependable on the vagus nerve stimulation. So this is the second pathway. And the third pathway is also related with melatonin, because melatonin basically is the main driver of deep sleep. So usually it's like a hormone of night. It's like a hormone of Dracula. It's appearing in evening. But melatonin
Mhm,
has two enemies. One of them is light. As you know, if you see the
mhm.
light, let's say in the evening, it can reduce the production of the melatonin. The other enemy is cortisol or stress. So more stress you have in the evening, the lower amount of melatonin, lower amount of deep sleep you will get. So one more time, I mean, we are coming back to the basics, that, I mean, if you're reducing the stress, we can increase the amount of melatonin, and that, can increase the level of deep sleep, during the night.
Wow. So this also mitigates cortisol.
I mean, some studies shows that it mitigates. We don't have a lot of data regarding this, but in general, if you are in this parasympathetic nervous system, which is rest and digest, you are not cortisol driven, person. So there is like a correlation between the, if you are in the parasympathetic, you are like cortisol levels are a little bit decreased. I mean, those systems are not like the same, because the cortisol and the parasympathetic nervous system is like a different systems, but for sure it's influencing a lot. If you are in this rest and digest phase, you have lower amount of cortisol. It cannot be
Mhm.
that you are in rest and digest and you have high cortisol, etc. It's not 100% correlation, but there is correlation between those two systems.
Interesting. Now, nurses and others who are watching, I really want to again underscore how simple this device is. And if you go on, first of all, if you go to powerupnursing.com, you'll see that address on the left-hand side of your screen. Go to shop. We have a link called shop. Go down and you will see under stress Pulsetto. You'll see the brand Pulsetto. You can get a discount there, but it links you directly to the website. And the website is so full of research, but you can also sign up for a newsletter. And I get probably every other day the science behind this device, which makes me feel better as an ambassador, as I see that Pulsetto is a company. uh, just like Ultra Human, our other company, or Charlotte's Web, that has invested a lot of its profits back into demonstrating the science. So I'm very comfortable as a healthcare provider advocate being able to talk like this. But
Yeah, we
having
have,
said,
and sorry, we have on the list a lot of trials. By the way, some of the trials, it takes time. It's not like you can do it in 1 month. Some somewhere and etc. For example, we started in January a huge clinical trial here locally, but a really huge clinical trial with sham group. It means that we will test placebo and etc. But also at the same time, we are running around 4 different mini studies with different things, with army, with sport professional people, because there are a lot of angles of the vagus nerve stimulation. It's not only about stress and sleep, like I said, it's also very related with migraine, with the pain. So of course, we as a young company cannot tackle all possible angles. That's why we need to make priorities, and etc. But at least 5 studies are running right now, and we believe that this year we will get more and more benefits and more claims, about the vagus nerve stimulation, benefits in the other areas, not only in this parasympathetic nervous system activation.
Mhm. That's exciting. And I know that we will have you at our national symposium for nurses in Miami. But I wanted to go back just to show people how absolutely simple this is. Nurses, you can wear this on the floor. And people will just think it's a cooling agent or whatever music, who knows? But you download an app, you buy this. The app doesn't cost you, and there is a premium that has other things, but I haven't done that yet. I do have to do that, but you can see the sessions. Here's the actual thing. So you put this on, you put your transduction gel, and then you can do stress. So it's a stressful moment. You can do anxiety, sleep, burnout. Nurses, there's a setting for burnout, and then pain. So, and then you can activate what days you want to do it, or you can do it in the moment when it's most imperative for you. Vita, can talk to us about what's the burnout app, and how is the burnout routine, and how is that different from like anxiety?
So I mean, every signal has like four different components. It's voltage, amplitude, pulse wave, and pulse width. It's a science behind it, but you just need to understand that in general, the vagus nerve is not like a one cable. It's more than 200,000 fibers. You know, it's like a network of like you can
Where
imagine
is
as
it
a
located? Where's the
it's
vagus nerve located?
it's coming from the brain, and it's go in every organ, so it has branches in every organ. The uniqueness of this nerve, this is only one nerve who has like attachments, the branches in every organ, lungs, liver, pancreas, and etc. So it's going from the brain to the internal organs, but it's like a network, so it's like a 200,000 fibers. And the most amazing science, that when you're activating different fibers, you're getting different things. So one fibers are responsible for parasympathetic nervous system activation.
Mhm.
Other fibers are responsible for releasement of acetylcholine, which is a very strong neurotransmitter which participates in the inflammation pathways, etc.
Oh.
Other fibers are responsible for nitric oxide, which helps with a migraine and the cluster head pains. Other fibers are responsible for gut-brain axis, and etc. So that's why we are playing on the laboratory or R&D side with those four different components like voltage, amplitude, and etc. to tackle different fibers of the vagus nerve. So this burnout, it's we created basically we created for people like nurses, because we see from our customer database that typical burnout is like a three categories at least. It's the business people, they have huge issues. There is nurses and women after birth. So like a three
Ah,
typical categories of most common burnout cases in what we see from our data. So we made many studies, little bit stronger signal, it's little bit deeper signal. Genetically you will not feel maybe any difference because you cannot feel this, let's say, pulse wave. Is it one size, or is it other size? But it's little bit the little bit, let's say, deeper and stronger signal which activates specific fibers which are responsible for relaxation and for the minimizing the burnout negative effect.
that's just amazing. And by the way, I found the direct link. So you just go to powerupnursing.com/Pulsetto. Doesn't get any easier than that. And you get your discount and you get all the science. And this little baby right now is only around $200. It's like going out to a nice dinner. And instead of that nice dinner, you really have access to, and like I have to take this off. Why? Because I put it on the anxiety, and it really does. I need a certain amount of anxiety to do a good podcast. I need to have that kind of adrenaline rush in order to bounce around and do everything. This interrupts me. And I love it, right? I'll use this after I get off so that I can switch gears. But you say you don't necessarily feel it, but I do. And for instance, my 13-year-old grandson who lives with me wants it because he also has autism, high functioning, and when he feels like he's emotionally rushed, this he feels it like within a couple minutes. So maybe on the bigger things like chronic pain or others, it takes more time, but on the anxiety setting, it is within a minute
Yeah,
or
I
two.
mean, we created this when you have panic attacks,
Really?
specifically, like sleep program. We created for those who has issues with, let's say, sleep. And for example, we have a lot of customers who are waking up in the middle of the night, and they cannot go to sleep anymore because of racing minds and etc. So this is specifically dedicated for those situations. The same with this pain management program we created for specific studies related with the inflammation related pain. We made study with bacteria. It's a like arthritis type of pain, basically it's inflammation.
Inflammation.
So the duration is much longer, and the signal is also quite strong, in this program. So
So
programs
it's
are
not
different.
emotional. Your research is now going to the point where it's not just emotional, it's also for chronic pain, and
Yeah,
all of
yeah.
those are mental. We know that stress is the biggest cause of inflammation, which is simultaneously the cause of pain. So it's one big vicious, neurological cycle, yes?
But yeah, we can look to the neurology, but also we can look to the chemistry side, because electric, these impulses, they're creating chemical movement of acetylcholine, which is very strong neurotransmitter, and this neurotransmitter participates in the inflammation pathways and reducing the inflammation, and that's why it's good for the pain management. So basically, what we see from our studies, that 5 minutes of electric stimulation in the next 2 hours, increasing acetylcholine level in the bloodstream for the next 2 hours. So it means that only 5 minutes of electric stimulation enough to activate this neurotransmitter, and then he is doing his job, to do the pain management, etc. So this is also very fascinating topic, and personally for me fascinating, because like I said, migraine is also part of inflammation. So this is my like a personal passion, to really prove it, to claim it. Generically, there are around 400 studies already about pain management and vagus nerve stimulation, but we want to prove it that it's also work for pulsetto specifically, and how it's working. Like I said, the specific fibers of the vagus nerve are responsible for inflammation, acetylcholine, and pain management, and we want to target, very precisely those fibers. So that's why we're playing with those 4 parameters, like voltage, amplitude, and etc., to target like a specific fibers of the vagus nerve.
I'm hearing you, and you're obviously so passionate about this, and your young company is taking the world by storm. I go to a lot of biohacker conferences, and those of you that don't know what that is, it's those of us who think we can live to 150 and still be walking around happily. I call myself a biblical health person. I believe that we can live longer if we just get rid of all the stresses and all of the things that the modern world has brought to our life. Having said that, you're so passionate about the science behind it. I have seen other vagus nerve stimulators at these conferences. Lots of them are directly on the pulse. Why did you choose to do it this way? And what do you think makes this particular device superior?
I mean, in general, the vagus nerve stimulators and who are doing these products, I mean, I have big respect, because I think all of us are educating the market about the benefit of the and uniqueness and universality of the vagus nerve, So there are different devices in the markets. Of course, there are, let's say, you need to understand that, let's say, from those 200,000 fibers, around 60% are on the neck region. Just
Okay.
just biologically,
Mm-hmm.
ear has quite a big amount of I mean, this tragus area. So that's why there are devices who are like a clips on the ear,
Mm-hmm.
but much more fibers on the neck, uh, chest, wrist. There are some fibers, but it's very very small amount of that. So that's why we chose the neck, and we are only one device who's doing it bilaterally, so from both neck sides.
Mm-hmm. Mm-hmm.
Sides. It means that we are quite fast. We don't need like a 20-minute stimulation to activate the nerve. It's like 5, 6, 7, minutes of the stimulation. And we are
Mm-hmm.
only one who are doing it hands-free. Yeah. So like I said,
Ah,
you can multitask, you can do your other jobs. You don't need like with
you could be a
meditation.
nurse
Yeah,
bedside.
I
That's
mean,
a cool thing.
for example, meditation or breathing is also activating at some point the vagus nerve. You need to do it for 30 minutes and etc. But with meditation or breathing exercises, you need like a dedicated practice, like a silent environment and etc. With this device, you can be in airport, with a super noisy environment, but still you can activate the I mean, you can multitask. So we are only one hand free, and we are only one who is doing bilaterally on that, let's say, the neck, where the biggest amount of fibers exists. But there are ear stimulators which I have big respect for them, because
Yeah,
tragus
I
is
used to have a Medi Spa myself, And I would offer sessions with the one that you clipped on your ear and you dialed it up. And I'm going to say this because it's actually they're doing quite a bit of research in that area, but it helps with um, mitigating urges to smoke or if you drink too much. The vagus nerve stimulator, when you kind of cut off that
Yeah.
anxiety around a substance, it helps substance abuse. They talk
Yes.
about it. Or what about PTSD? I know that's a huge thing. And I know we have a lot of veterans that are a part of Power Up Nursing. Can you
It-
talk
it's
about that?
it's it's in our next list because we just got investment from military related fund, because in order to make those trials and etc you need money, you need for
Yes.
R&D, for the product development you need money. It's a big money. It's not like that we can get it from our revenue or whatever, so we just got funding from military fund, and they want that we will work with the rehab centers with ex-veterans and PTSD.
Wow.
So here in Europe, there is Ukraine and Russian war. It's
Hmm.
not far away from our country. Basically, we are neighbors with Ukraine. So the first test and first trials will be with Ukrainian soldiers who, believe me, they have a lot of PTSD right now and etc. So already now we are speaking with rehab centers about Pulsetto usage in PTSD with the trials. So it will be more and more data
How
about
do
this. But
you monitor? How do you monitor? Remember in the beginning, I said, hey, this ring monitors. Without the ring, how do you monitor your science?
typically now what we, and I will give you premium account, because with premium account, yeah, it's not for free, but with premium account we are extracting data from your wearables, and showing
Oh,
we are showing that, for example, if you're allowing to share your Apple Watch or whatever data, we are showing how your heart rate and heart rate variability is changing before and after the stimulation. But
got
if you don't have wearable, for example, now we are doing a study with military and sport.
it. Hmm.
So for those people who don't have these wearable devices that they cannot track real, let's say, data, we are giving like a questionnaires. There are like a most popular, let's say, depression, PTSD questionnaire, sleep related questionnaire. So we are doing it before, and then we are doing some protocol of the stimulation, let's say 14 days, and then after the stimulation we are doing the questionnaire. So I mean, there are ways, but of course the tracking way is the best way, and sometimes we are even mixing. So it's like the best approach is to make it questionnaire plus the tracker who shows the data that, for example, your HRV increased during the 14 days, period, and etc.
Good, good. All the more reason for me to get you as a leader in touch with the leadership of Ultra Human, because it's changed a lot of our nurses' lives and continues to do as we spread the program at US hospitals. So that's very, very exciting. I'm going to start winding us down because everybody's busy, and I appreciate everyone listening for as long as you can and as long as you do. Please feel free to download and share the link. But I want to ask you, because I really what I really like about you, Vita, is that you can tell that and it was certainly like that with your co-founder, that this is a vocation for you, that you really want to help people like your wife get rid of suicidal pain, to help people with stress and etc. What what would you say are the most compelling reasons, or even one reason, for someone who probably has all kinds of gadgets already to invest in themselves by investing in Pulsetto?
I'm big believer, and I will bring this concept to the world about stress resilience in general. I believe that little bit amount of stress is good. Too
Right.
much and chronic stress is bad. So this is like the main sentence. But I big believer that stress and stress resilience is like a muscle, like you're
Mhm.
doing in the gym, dumbbells, and etc. And then you are getting bigger and bigger biceps, and you're becoming bigger and bigger, stronger and stronger. So the same with stress resilience. If you're training it, you can be more and more resilient. And what it means that when the stressor will come, and stressor will come, You cannot avoid stress. You see the COVID, you see wars. I mean, it will be more and more stressors. But if the
Mhm.
stressor will come and you will have strong stress resilience, it will not affect you, or you can recover very fast. So this is my big passion. That's why we want that 100 million people will wake up happier with stronger resilience, with this strong stress muscle. And we big believers, and we are showing by data that by using Pulsetto constantly, you can increase the HRV, this metric, which is basically metric of the stress resilience, the stress muscle. So we want to improve the stress muscle for the people, that, in those daily situations when somebody, when somebody is stressing you, and it can be million factors, you will not react so fast, so stressful. You will recover, and etc. Because this will be the one of the main things of the longevity. Yeah, the
Mhm.
stress
And so I was going
resilience.
to say that's a
Otherwise,
bioacro motto.
otherwise, chronic stress, inflammation, and you can check basically inflammation related deaths right now represent like 99% of deaths. If
Wow.
if like
Right.
a
If you really look at it, you're right. Heart
yeah,
disease, stroke,
it's inflammation. It's inflammation. Well,
even
cancer is
cancer, they say. Right, right.
it's inflammation. Previously, like a 300, 400 years ago, infection was the main driver of death. Yeah, like
Mhm.
big infections. Now, I mean, our medicine can heal, can deal with infection, with those super big, problems, and etc. Inflammation is the main, and one of the main factors is chronic stress. So the stress resilience, allow you to avoid those chronic stress situations. So I big believer that we need to talk not only about sleep, nutrition, and physical activity, but we need to talk about recovery, and I'm happy that more and more brands and products are talking about recovery, but also about stress resilience as a fifth or fourth, let's say, fundament of health.
Mhm.
So this is my passion. This is where we want also to go, and to have more and more people who are training, who are measuring the stress resilience, and they're becoming stronger and stronger at this topic.
I want to applaud you. I want everyone that's listening to do your research. Even if you're not ready to buy, go on this link and look at the science, and it'll blow you away for yourself, for your significant other, and for your children. I mean, it is the way to, in my opinion, using it, but also reading the research about it, a way to really disrupt the stress cycle. And that just in our world, as you pointed out, Vita, is increasing on the daily. So thank you very much for your vision, for your hard work, for your technology. I'm sure we will hear more and more from you. I'm sure our nurses will meet you in 2026 as we plan a very large symposium for nurses in the United States. And thanks again. And if you have any questions about Pulsetto, I'm going to put up this email, Povilas at Pulsetto Tech,
Yeah, it's
who
my
has,
co-founder. Yeah, always you can write
you
to
can
to
write
to.
him. And please get your questions answered. Get one of these on your neck and live a less stressed, less chronically diseased life. Thank you very much, Vita.
Thank you very much for the interview. Thanks.